Global Health, which is basically popularly known as Medanta, reported what was a good set of Q2 numbers. We had occupancies which have risen significantly both year on year as well as sequentially. The margins have expanded as well. In fact, the company is also seeing good international patient volumes and realization. To discuss this and more, we have Pankaj, who is the Group Chief Executive Officer, and Mr. Dr. Naresh Trehan, who is the Chairman and the MD of the company, joining in. Dr. Trehan and Mr. Sahni, thank you very much for taking the time out. Dr. Trehan, I'm going to start with talking about the numbers with you. I know you're not very focused in terms of the performance and you're focused more on the quality, but I remember that when we had this discussion about margins in your hospital in Delhi last year, you did mention clearly that, margins would probably move up. And that's what's happened. 25% in terms of margins is what you've recorded. What led to that improvement? And is it sustainable now? Is that a base business performance?
So if you notice the numbers, that our growth has been basically in the growth of number of patients that we treated. So we have, always been at the level where we offer the highest end of care with all the latest technology, all the quality of physicians that we have, the services that we have are of the highest quality. But at the same time, we try to keep the cost to the patient as reasonable as possible. So trying to keep it affordable, what has happened is that the public and the physicians and the doctor community has actually appreciated it. And if you notice, the number of patients that we treated has gone up, the occupancies have gone up, and so has the number of the numbers of financial numbers which follow. But it's on the back of increased activity. It's on the back of taking care of many, many more people. So that's the real reason for the uptick. And hopefully it will keep growing because that's what people have now recognized, that the quality Medanta as an organization and institutionally, and also the level of doctors that we have that are delivering this service is exceptional. But if you want to drill down on the numbers, I'll request Pankaj to give you the exact breakup so that you can understand the granular level.
Just before we get to Mr. Sahni, I just wanted your thoughts in terms of what's taking place on surgical revenues, Dr. Trehan, because that seems to be increasing. And the reason for that is because high-end surgeries seem to be increasing with robotics and other such, high-end organ transplants, etc. On account of that, if you can give us some sense in terms of what the surgical revenues have been or how it's growing for Medanta, and what it's doing to the overall business as well.
So, like I was saying earlier, because of the fact that we do have the best of kind in every specialty on the same platform, we are able to take care of the most complex of procedures. So people who we already had surgery somewhere which didn't work so well, we have to redo it, or there are multiple organs involved in the same patient. Like if I give you an example of heart surgery, you have multiple which need to be replaced. You have coronary bypass to be done at the same patient, and also the aorta is diseased. So if you have those kind of things, Medanta is very well equipped to take care of things like that. Also, complex cancer patients. Also, head and neck surgery is a very complex subject. So we are the leaders in all these things. Liver transplants, which are not simple, living donor transplants are one of the main things that we have. So we have added lung transplants. So all these things are very complex. Hearts transplants we were doing already. Kidneys is routine. Robotics has been added in almost every specialty. So that's where the push has come from. And so, like I said, we have not really increased any tariffs of any meaningful increase. But at the same time, we do have increased revenues because of these complexities, and intensive care is our specialty. So people from all over the country actually come in for that.
All right, so let's take this in the form of numbers and what they mean for the second half of this year. Pankaj, if you could give us a sense, the first half your revenues are up 25%. Wondering if this run rate continues into the second half as well. And margins at around 24-25%, does that sustain? What proportion of your revenues are you expecting, coming in from international patients?
So currently, if you look at our performance over the course of the last 6 months, we've seen a very strong growth, as you rightly said, about 25% year-on-year growth in revenue, about 46% growth in profit after tax, and about a 36% growth in EBITDA. We see this growth, as Dr. Trehan as well mentioned, coming in from a lot of the volume growth. And not only in the newer hospitals where we have seen some amount of maturity of some of those assets in Lucknow and Patna, but we've seen very strong growth, about a 13% volume growth in our mature facilities as well. So this is off the back of the strategy which we had talked about, which we've been executing very well on, around bringing in good quality clinical talent, both in our newer hospitals and our existing hospitals. We see some of that playing out. We see bed additions in our new hospitals, many of which came towards the end of last financial year. We see that playing out, and we expect that to continue. And as our Patna facility ramps up, we expect that will play out as well on the positive front. The other thing that's happening, especially in the newer facilities, is that we are getting the benefits of the operating leverage. As you're aware, we build out fairly large institutions, 1,000 beds, Lucknow, 650 in Patna. So as we see these hospitals fill up in capacity, we expect to get the benefits of operating leverage, and we feel fairly confident that that will allow us to sustain and to look at strong financial performance as we move forward. And with Noida coming on as well, we have a good amount of growth expected to come. So overall, when you look at the organization on a portfolio basis across all the assets that we have, good growth in the mature hospitals, some of the hospitals which are newer, 3-4 years old, performing exceptionally well, and new assets with growth coming on board as well. So overall, very, very balanced portfolio, and this gives us a lot of confidence. But as Dr. Trehan mentioned, we remain committed to our core, bringing in solid talent, bringing in new technology, and frankly speaking, that is what has been the success for us thus far, and we see no reason to change that strategy.
Okay. All right, Mr. Sahni, as well as Dr. Trehan, always a pleasure. Thank you very much for joining in and speaking with us, and season's greetings to you and everybody at Medanta. Thanks very much for joining in and talking to us. We need to take a short break, but we will have another hospital company join in. The management of HCG, or Healthcare Global, which is a cancer-focused hospital, will be joining in next. Stay tuned.